Hello, and welcome to ElderBloom, your trusted source for senior health and wellness. Today's topic is one of the most important we've ever covered, because every year, strokes affect millions of older adults, and many of those strokes begin with silent, subtle symptoms that go unnoticed until it's too late. In this video, we'll talk about 5 silent symptoms of stroke that seniors must never ignore, and common foods that may be quietly harming your body. As you age and healthier choices to enjoy instead, this video could save your life or the life of someone you love. So please, watch closely. Let's begin with 5 silent symptoms of stroke. Silent symptom number 1, sudden confusion or difficulty understanding. Not all strokes start with slurred speech or collapsed limbs. Sometimes, they start in the mind with confusion, disorientation, or difficulty understanding simple words. You might suddenly forget where you are, have trouble following a sentence, or find yourself staring at a familiar object but not remembering what it's called. This isn't typical forgetfulness. It's sudden, strange, and unsettling, and it could mean that blood flow to your brain is being blocked. If this happens, don't wait. Call for help immediately. Every minute matters. Silent symptom number 2, sudden loss of balance or coordination. Imagine walking down the hallway and suddenly your legs feel weak or unsteady. You might stumble, sway, or feel like the room is spinning. This isn't normal dizziness or a result of standing up too fast. This is your brain's balance center losing power, a stroke affecting the cerebellum. The part of the brain that controls coordination can cause trouble walking, sudden clumsiness, difficulty holding on to things, or falling without any clear reason. Even if you recover quickly, treat it seriously. Mini strokes often happen before a major stroke. Think of it as a warning shot from your body. Silent symptom number 3, sudden trouble seeing in one or both eyes. Sometimes strokes affect the visual center of the brain. This can lead to blurred vision, double vision, sudden loss of sight in one eye, or seeing only part of your If you're reading a book and words begin to disappear, or if one side of your vision suddenly turns black or cloudy, don't wait for it to pass. That's a red flag. Many people confuse this with eye strain or cataracts, but timing and suddenness are what matter most. Silent symptom number 4, subtle facial drooping or uneven expressions. This symptom is easy to miss, especially when it's mild. You may look in the mirror and notice that one side of your face feels weak or heavy. Maybe your smile looks uneven, or your eyelid droops slightly. It might not hurt. You might still be able to speak and eat, but any change in facial muscle strength or symmetry could be an early sign of a stroke affecting the nerves that control facial movement. Try this quick test right now. Look in the mirror and smile. Do both sides of your mouth lift evenly? If not, or if your eye seems lower on one side, get medical help. Sometimes, facial drooping lasts just a few minutes during a transient ischemic attack, but these are urgent red flags. They often come before a major stroke. Silent symptom number 5, numbness or tingling, especially on one side. Have you ever felt pins and needles in your arm or leg? That sensation is common if you've been sleeping in an odd position, but it's not normal if it comes on suddenly. And without explanation, a stroke can block signals between your brain and your limbs, causing numbness, tingling, a heavy or dead feeling in the arm, leg, or face, often affecting only one side of the body. If one hand or foot suddenly feels asleep and you didn't lean on it, don't ignore it, especially if it's accompanied by weakness or confusion. Recap: the 5 silent symptoms seniors should watch for. 1. Sudden confusion or difficulty understanding. 2. Loss of balance or coordination. Sudden vision changes. 4. Facial drooping or uneven smile. 5. Numbness or tingling on one side. If any of these symptoms come on suddenly, unexpectedly, or don't go away quickly, it could be a stroke. Even if you feel fine afterward, seek medical care. Early treatment can prevent brain damage, disability, and even death. Now that we've covered the silent warning signs of stroke, something just as important for prevention: common foods that silently harm aging bodies and what to eat instead. Our food choices affect more than our waistline. They affect blood pressure, heart health, brain function, and stroke risk, especially as we age. Let's walk through a few everyday foods that might be doing more harm than good, and talk about simple swaps that protect your health. Problem food number 1. Processed meats, bacon, sausage, deli cuts. These are high in sodium and preservatives like nitrates, which raise blood pressure and stiffen arteries, both major risk factors for stroke. Eating processed meat regularly has been linked to a higher risk of heart disease and stroke in multiple studies, especially in people over 60. Better choice: grilled chicken breast, turkey slices with no added salt, or plant-based proteins like lentils and beans. Tip: look for labels that say low sodium and nitrate-free. Problem food number 2. White bread and sugary cereals. These foods may seem harmless, but they're quickly broken down into sugar, which spikes your blood sugar and increases inflammation. Refined grains also strip away fiber, which helps protect your heart and digestive health. Better choice: whole grain or sprouted grain bread, oatmeal with no added sugar, chia pudding, or a hard-boiled egg with fruit. Fiber helps lower cholesterol and keeps your blood vessels clean, critical for stroke prevention. Problem food number 3. Flavored coffee creamers and sweetened beverages. Many older adults enjoy a daily cup of coffee or tea, but what gets added into that cup can quietly harm your health. Most flavored creamers, even non-dairy ones, are full of artificial sweeteners or sugars, unhealthy trans fats, preservatives that increase inflammation. Sweet drinks like flavored lattes, packaged iced teas, and diet sodas can raise blood sugar, disrupt cholesterol levels, and stress the heart over time. Better choice: use unsweetened almond or oat milk. Add a dash of cinnamon for flavor. Choose herbal teas or black coffee with a splash of milk. Quick fact: a 2021 study published in Stroke Journal found that people who consumed artificially sweetened beverages daily had a higher risk of stroke and dementia, especially those over 60. Problem food number 4. Canned soups and frozen meals. Yes, they're convenient, but many of these are loaded with sodium, sometimes over 1,000 milligrams per serving, nearly half of your entire day's limit. High sodium causes water retention, raises blood pressure, and increases your risk for both stroke and heart failure, especially as your kidneys become less efficient with age. Better choice: make a large pot of homemade soup using low-sodium broth, lean protein, and vegetables. Look for low sodium or no salt added labels if buying pre-made. Add herbs like basil, oregano, turmeric, and garlic for natural flavor. Tip: always read the label. If the sodium per serving is over 400 milligrams, it's worth replacing. Problem food number 5. Margarine and hydrogenated oils. You might think margarine is better than butter, but many brands contain trans fats, which are now banned in some countries but still found in certain products. Trans fats increase bad cholesterol, LDL, and lower good cholesterol, a dangerous combination that clogs arteries and increases stroke risk. They're often hidden in store-bought baked goods, some microwave popcorn, non-dairy creamers, fried fast food. Better choice: use small amounts of real butter or olive oil. Choose nut butters with no added oils or sugars. Avocados are another great heart-healthy fat. The Mediterranean diet, rich in olive oil, nuts, and leafy greens, has been shown to reduce stroke risk by up to 30% in older adults. At ElderBloom, we believe prevention is powerful, and your daily habits are your strongest medicine. Let's quickly review today's most important takeaways. Stroke prevention summary. Watch out for these 5 silent symptoms. 1. Sudden confusion or brain fog. 2. Loss of balance or coordination. Sen. Vision changes. For facial drooping. 5. Numbness on one side. Protect your health with smart food swaps. Avoid or limit processed meats, white bread and sugary cereals, sweetened creamers and sodas, salty canned soups, foods with trans fats. Instead, enjoy lean proteins, whole grains, and fiber-rich foods, healthy fats like olive oil and avocado, low-sodium homemade meals, antioxidant fruits and vegetables. Your body is always speaking to you through how you feel, how you move, and even how you eat. The key is listening and responding with kindness, not fear. You have the power to protect your brain, your heart, and your independence one step, one bite, and one choice at a time. If you found this video helpful, please consider subscribing to ElderBloom and share this with someone you care about. You might save a life today. Until next time, stay safe, stay strong, and stay blooming.